So really pleased to be here today, and just want to say well done for embarking on this programme, which has so much potential to give. And the fact that it's really drawn from the Netherlands as well, I think just brings that real interest point, and it connects really strongly from everything that I've always gained and learned from working with families, especially in the most disadvantaged communities. So really pleased to see that. It also, of course, connects very strongly with all of the things that Michael Marmot has been saying for an awful long time, which again gives it real strength and foundations there. You know, everything he said about giving every child the best start in life, enabling all children, young people and indeed adults to maximise their capabilities and have agency over their lives, creating fair employment and good work for all, ensuring a healthy standard of living for all, creating and developing healthy and sustainable places in the community, and strengthening the role of an impact of ill health prevention, the nirvana that everyone's after. So the programme really ticks every one of those ambitions, and I think has the potential to provide really vital learning in a way that can be replicated. I know this is very much about working within the context of different communities, rightly so, but that approach in itself, I think, is one that not only can be replicated, but I think one that people will be looking towards for evidence of successful models, hopefully over coming years. And of course, it focuses on that really crucial time in a child's life, the first 1,001 days. And I'm not a health expert. I've always really worked on social policy, economic policy around families and children and young people and communities. But we know that there are frightening levels of health inequity in the country at the moment. Diabetes, tooth decay, obesity, I don't need to tell this audience, respiratory problems, difficulty with self-regulation, poor mental health, absolutely skyrocketing. And many of those for children without interventions and support to tackle it will translate straight into the experiences at school. And we've seen children who are struggling in school, struggling with behaviour difficulties, attendance plummeting, and in some cases exclusion. And those, in my view, much of that is preventable. So actually being able to understand the benefits and the gains for interventions are really important. And also levels of family vulnerability are also very high. As Children's Commission, I work with Professor Liam Feinstein to pull together and to start to provide a framework of what we call childhood vulnerability. We found that there were 2.3 million children, and this was 2019, growing up with family vulnerabilities, which might be poor mental health, addictions, or domestic abuse in the home. All absolute red flags around children's well-being, and domestic abuse being one of the largest drivers of children going into care. 2.3 million children. Now, that's 1 in 6 children. So for every classroom of 30 kids, you've got 5 children there who are growing up with this level of vulnerability. The other things we found out about it were equally shocking. We estimated that 1.6 million of those weren't actually getting help. And if you look at many of the cohorts of children where things have gone badly wrong, for instance, coming into contact with the Youth Justice Service, only 1 in 6 of those children who come into contact there have actually had interventions before in their lives. So the vast majority of children aren't getting the help they need early. We know that levels of vulnerability will have increased during and since the pandemic. And also because there's been this huge increase in demand and services continue to be stretched in terms of their financial capacity, we know that will have led and has led to higher levels and thresholds, which just fuel levels of crisis intervention and take away from early intervention. So if we're going to begin to tackle these inequalities, we need to reset the system. And that, of course, means that we have to look at the earliest opportunities to help children and families. And people will often say, well, where would you start? You know, where would prevention start? And there's always this argument, is it prevention if you help a 10-year-old? Does it have to be at a certain point? Well, you start with the first 1,001 days, because that really builds a foundation, as you've heard, for future development, while also recognising that distinct vulnerability of that period of life. And I think for all of us, we know that pregnancy, birth, in the first 24 months can be tough, you know, as a parent. If we think back to our own experience of parents in the room, we know that it's kind of a mix of wonder and trepidation in kind of equal measure, especially for that first child. This physical changes in relationships, financial stresses, and planning for the birth can all add additional stress. And of course, for some parents, that can be overwhelming, especially those that are already struggling, and there's already those vulnerabilities in place. And following the birth, it's more likely to be those families who are without additional help are going to find it hard or harder to provide the care and attention their babies need. So this is a period of time which is very precious for both the child and also the family unit. And the bonding between parents and child following the birth really set the foundations of future health, relationships, and successes. Physical and cognitive development, language, emotional development, and secure attachments, brain development, and wider health factors, all set up during this crucial period. And the good news with all that, of course, it is, as everyone says, this window of opportunity. Sometimes in social care, you talk about it as being a golden moment where, you know, there's a particular increased level of responsiveness. People want to do the best for their child. They can see the wonder of their child being born. So things all start to come together with much more receptiveness during that period. But there also has to be the right interventions there that understand that and work with parents to be able to do that. So I think, you know, the kind of support that parents are looking for, and for those that have looked at this in some detail, all the evidence shows, you know, ensuring that children's development in terms of their brain, its optimum development, nurturing during that period of time. Over the first 18 months, it's been calculated that connections in the brain are created at 1 million per second. Now, imagine how tiring that would be at kind of our stage of life. But also that 80% of the brain is developed during this period of time, meaning that it can have a lifelong impact on children's mental and emotional health, and indeed adults too. And there are some who say that would maintain that actually if you can't recover that period of time, certainly it's harder to recover it after that time. But with stress, whether this is a pregnant mother suffering from stress or vulnerability in the home, the baby can experience that real sense of danger, setting all the responses to kind of high alert. And it then becomes kind of almost programmed to fight or flight, which can happen where there's overwhelming stress from any of the causes within the family that we've talked about. And then there's a path without intervention clearly to be seen in terms of social and emotional problems in subsequent later life. But it's also important to realise, and sadly, there's a library of care reviews here that will show this, that babies are disproportionately vulnerable during this period. And sadly, we saw that tragically during the pandemic, where the children who were most at risk of harm during that period of time were teenagers, and their risks were outside the home when they were living in vulnerable households and they went out and there were adults looking to exploit them, but also children within the home. And the serious case reviews that we've seen coming through somewhat relentlessly over recent months and years, sadly, is testament to that. And with an estimated 1 in 6 children living with complex family situations, you can see that heightened risk and the dangers that can bring. The best chance to turn this around, this isn't a kind of scenario of doom. It's really looking at what happens when we don't tackle this. But there are things we can do. And of course, the best time to start there, in my view, and I think evidence shows, is that first period, the conception to two. And there have been some developments in policy terms that have managed to get themselves into pilot phase and into some government programmes at the moment in the Best Start for Life. And that's been developed largely and championed largely by Andrea Leadsom MP, who's back at the Department of Health as a minister now. And she relentlessly, for years and years, have really, almost like a dog with a bone here, has never let up on this. She's always championed it. She's run a number of reviews, whatever roles she's had, even at one point when she was running for leader of the party, she put this forward as an absolutely crucial period of life and a crucial intervention that we as a country should seek to have, not only for just those individual children, not only for the families, but for the country as well. So it has been a life mission. I give her that absolutely. And she has worked to evidence, to persuade, to convince, and occasionally to push her colleagues to invest in babies and their families. It also has cross-party backing, which I think is really, really important to get the depths of roots we want with this. It's got about 300 million at the moment in terms of finances behind it. Now, whilst that's really welcome, it really is only just the start of the kind of systemic changes in the approach to supporting parents and babies in the first 1,001 days that we need to see, especially in our most disadvantaged communities. And the urgency of that response, I think, is really real. We're seeing nothing short of what I think is an emergency in children's health inequalities, and there's nowhere where that's greater seen than in parts of the north. And many of the statistics that I'm going to just quote now, they're from the N8 Universities and Health Equity North in the Child of the North programme. You're going to hear from Kate later. But the scale of inequity and the worrying patterns from lower life expectancy to a whole range of different health inequalities is one that I think should get an awful lot more attention than they do and should really power the emergency response. So children born into the poorest fifth of families in the UK are almost 13 times more likely to experience poor health and educational outcomes by the age of 17. It's there for us to see. There are above average infant mortality rates in the north. The 3 northern regions having amongst the highest level of infant mortality equate to a shocking 144 extra infant deaths in the north in 2021. This is happening. Of the 72 local authorities in the north of England, 52 have lower average levels of very good or good health than the national average. Babies born in the north have a life expectancy of at least 1 year less than the national average, with the northeast being the worst affected at around 3 years less. There are higher rates of disability in the north, higher rates of economic inactivity due to ill health in the north. It's all before us in plain sight. And of course, we need to tackle not only the symptoms of inequity, but also the root causes. And so much of that takes you to poverty. 1/3 of children are growing up in poverty. And according to Joseph Rowntree Foundation, with a recent survey report they did, 1 million children are now living in destitution, a phrase which even I would have found unusual to have heard even about a year ago. But this is now the state we're in. And poverty fuels health inequalities, as you'll know. And there are higher levels of child poverty in the north, especially entrenched poverty, intergenerational poverty, which is the most difficult to either escape from or to fix. The proportion of areas with child poverty over 40% are twice as high in the north as the rest of England. 1 million households in the north are few poor, proportionally more than in the rest of England, and children in the north are more likely to be living in food insecure homes. And food insecurity rises where there are children in the family, because those families with children are the hardest hit. And of course, with that, families in the north are most vulnerable to the cost of living crisis and cost of living pressures, again, which are felt much more when there's families with children, which in itself leads to financial problems, rising debt, stress, suffering. And there's a shocking statistics here that research shows that for each 1% rise in poverty, it's associated with an extra 5.8 infant deaths per 100,000. Again, it's in plain sight. This isn't a concept. This isn't this isn't something which we're talking about in ethereal terms. It's the reality. And there's families who are living this reality today that we need to find a much better solution for. So it's against this backdrop, and that was a little bleak, I apologise for that, that the first 1,000 Days project that's been launched today takes on even greater significance and relevance. It's innovative, it's timely, and it's developing a systematic approach to support which is really based on strong relationships, bespoke and coordinated responses, place-based support, group support, and also really importantly, engaging and strengthening communities. And this is what we've seen with some of the community support that we've seen through the Commission of Young Lives over the last couple of years. Really long-term work with communities in some of the most disadvantaged areas to build not only their resilience, but also their capacity to be able to provide support for families in their own community. So huge, huge gains to be based. And the centering group care model recognises, of course, what works in one area might not work in another, but actually the core bones of it are about being able to work with communities, to be able to work alongside families and others to provide that support. And that long-term change is something that I think there is the potential to build here. That approach of engagement, relationships, respect, are what families have told us that they want to see. They want to know that their views are taken seriously and listened to. They want to know that people understand their lives, that they're not seen as, not coping or judged, that their lives are understood. And importantly, that people are getting alongside them, not doing stuff to them, because that's so often what they feel they've experienced in the past. And the number of parents in disadvantaged communities that have told us over recent years of their reluctance to become involved with statutory and public services tells its own story. I've been shocked by how often this has been said to me over recent years. They complain of a one-size-fits-all system, high threshold rates, lack of advice and support early, focus on process, constant assessment, referral, more assessments. And these are all tough criticism, but they're also the reality for a lot of families in poor areas, and they stop those families that need help most getting the help they need. So we need to find different approaches, which of course this project offers. I advocated for and delivered Sure Start programs back in the day, place-based, relational, community-centred approaches. They were community-led and based solutions at their best, and ones that families say they want and the evidence suggests have the greatest impact too. So there's lots to draw on from that too. And of course, there's lots to draw on in the region. I've been really impressed by how innovative solutions are being developed, sometimes because, resources are very tight and levels of need are high. I'm impressed by the work in Bradford that I know some are involved with in the room in terms of intelligent and connected data, connected services, that joint mission to reduce health and education inequalities, and that focus on models of community development, and a huge recognition to those real achievements of the team, and not least Mark Williams with that. So all of those have the potential to create that new approach that I think is so exciting, but also so needed. We want parents to feel confident that they're raising their children in a supportive environment. There's people there that they can turn to. We want there to be, a holistic, joined-up approach so that families who might have all sorts of things going on don't have to go, through from one service to the next, retelling the story, trying to kind of draw up their own network of support. We want that to be made easy. We need the professionals to be able to work together from pregnancy onwards, and for those contacts and relationships that parents have in place during pregnancy to see through, whether that's midwives, health visitors, GPs, others. And when parents are experiencing difficulty, we need to make it easy to be able to talk about that, to be able to sometimes identify what they are, because, if you're having a difficult time, you're often in the least possible place to be able to stand back and try and work out what's going on, and make sure that those specialist services are there whenever they are needed. So within all of that, the potential to create a new experience that can be shared in a very communal way, with long-term supported network of support, I think is amazing. It, of course, all needs beyond the realms of this project to take place within a wider context of renewal in our most disadvantaged areas, better housing, better use of public space, better connected services, that all understand that you need to work better together to strengthen communities and help them to be more sustainable. And just as the first 1,001 days is that window of opportunity for families and to be able to work with families, I do think that this programme as a whole provides a similar window of opportunity for others in those wider areas of policy to be able to work together with this project to really make the difference. I mean, I firmly believe that we need a revolution in the way that we approach the first 1,001 days for children and families, not only on the scale of what's delivered, but also in the approach we take, the way it's delivered alongside families, alongside communities. And I think we have the makings of that very much in the project that we're all celebrating here today. I really look forward to doing anything I can to help support it, but also to learning those lessons that I think will be under incredible demand. I think people will be biting your hand off for this over coming months, and wish you all the best in the project as it unfolds. Thank you.